This show is part of OnePlace, a daily network of focused briefings across the stories people follow most.
Welcome to our daily roundup. We are diving into the latest breakthroughs in medicine, neuroscience, and social science to keep you informed on the developments shaping our world today. Let's get started.
The FDA just approved a convenient new obesity pill.
Specific videos might actually help reduce deep racial bias.
A new drug helps early morning workers stay awake.
Colon cancer carries a unique and identifiable microbial fingerprint.
Hypocrisy stems from a specific communication breakdown inside the brain.
Guided meditation can help you find joy during hardships.
Mobile mindfulness apps are proven to accelerate visual processing.
Insurance status significantly impacts survival rates for young patients.
First, the FDA's latest approval. The Food and Drug Administration has just approved Foundeo, a new daily pill from Eli Lilly designed to treat obesity. This marks the second GLP-1 pill to hit the market following the approval of a pill form of Wegovy late last year. What makes Foundeo particularly interesting is its chemical makeup. Unlike many other obesity treatments that are peptides, Foundeo is a small molecule chemical. This means the body can absorb it much more efficiently without the strict fasting requirements seen with its competitors. Patients can take it any time of day, with or without food, which is a massive leap in convenience for those who struggle with the timing of current medications. The FDA even put this on a fast track, approving it in just 50 days because they view obesity treatments as a national priority.
The clinical data is quite impressive, showing that patients on the highest dose lost over 12% of their body weight over 72 weeks. While the most common side effects remain gastrointestinal issues like nausea and constipation, the ease of use could be a game changer. However, we have to talk about the hurdles that still exist, specifically cost and insurance coverage. Even with a more convenient pill form, many patients find these blockbuster drugs financially out of reach. Eli Lilly's decision to develop a brand new ingredient called orforglipron, rather than just repurposing their injectable ingredient, shows how competitive this market is becoming. As more options enter the field, the hope is that competition might eventually drive down prices. But for now, the focus is on providing a choice for those who prefer pills over weekly injections.
Next, reducing racial bias. Researchers have discovered that watching a specific, emotionally engaging video can actually reduce racial bias and increase generosity toward Black Americans. This study, published in PLOS One, used biological measurements to identify content that captures the brain's attention in a way that traditional methods cannot. Scientists Yilong Wang and Paul Zak focused on what they call neurologic immersion. By using smartwatches and algorithms to track brain activity, they identified videos that resonate deeply with viewers. The goal was to find a scalable solution to outgroup bias, which is the evolutionary tendency to favor one's own social circle. While face-to-face interactions are the gold standard for reducing prejudice, they are difficult to organize for millions of people. This research suggests that high-value media could serve as a practical, digital intervention to improve social connections and reduce tension on a much larger scale.
The methodology here is fascinating because it uses the brain as a predictor. By measuring the responses of a small group, researchers could accurately forecast how a larger population would react to the same video. In their experiments, participants who watched the high-immersion video showed a significant decrease in negative attitudes. This wasn't just about how much they liked the video, but how their brains actually processed the emotional narrative. The implications for media production and social advocacy are huge. If we can identify exactly which stories trigger the neurologic state of immersion, we can create content that effectively bridges social divides. It moves the conversation from subjective feelings about media to objective data about how stories change our biological state and, subsequently, our behaviors toward others. It is a high-tech approach to a very old human problem.
Now, help for early workers. Millions of people start their workdays before the sun even comes up, and a new clinical trial suggests that a drug called solriamfetol could be the key to keeping them alert. Many of these workers suffer from shift work disorder because they are waking up when their brains are biologically programmed to sleep. This isn't just about being tired. It's a serious condition that affects concentration, safety, and overall job performance. The study, led by researchers at Mass General Brigham, found that those who took the drug were significantly more productive and stayed sharper throughout their entire shift. Interestingly, many people who start work between 3 a.m. and 7 a.m. don't even realize they are shift workers. They just think they are early birds, but their bodies are actually struggling against a deep circadian mismatch that can have long-term health consequences.
This research is vital because it addresses a major gap in sleep medicine. Most previous studies focused on overnight workers, but the early morning crowd is actually much larger. Senior author Charles Chasler pointed out that this is the most common type of non-standard schedule, yet it has been largely ignored in clinical trials until now. The drug solriamfetol, also known as Sunosi, helps bridge that gap by promoting wakefulness during those critical early hours. For someone operating heavy machinery or making high-stakes decisions at dawn, this could be a literal lifesaver. It is not just about caffeine or willpower. It is about managing the biological reality of the human clock. As our economy continues to demand 24-hour availability, finding ways to support the health and safety of these workers is becoming an essential part of modern occupational health and safety protocols.
Next, a colon cancer discovery. Researchers at the University of East Anglia have made a discovery that could change how we treat colorectal cancer. By analyzing DNA from over 9,000 patients, they found that colorectal tumors host a unique microbial fingerprint that sets them apart from other types of cancer. This challenges the long-held belief in the scientific community that every type of cancer has its own distinct microbial signature. Instead, it seems that colorectal cancer is unique in how it consistently hosts these specific microbial communities. This is a major shift in our understanding of the role microbes play in the development and progression of the disease. Because colorectal cancer is the second leading cause of cancer-related deaths, understanding this fingerprint could lead to much more precise diagnostic tools and personalized treatment plans that account for the specific bacteria present within a patient's tumor.
The study utilized whole genome sequencing data to strip away human DNA and focus entirely on the microbial DNA left behind. Lead researcher Dr. Abraham Gihawi explained that as this type of sequencing becomes more common in hospitals, looking at these microbes could become a standard, low-cost tool for improving patient care. It allows doctors to see not just the cancer cells, but the entire ecosystem living inside the tumor. This information can help predict how aggressive a cancer might be, or how a patient might respond to specific therapies. It opens up a new frontier where we might treat the microbes alongside the cancer itself. By identifying these distinct signatures, we are moving closer to a future where a simple DNA analysis of a tumor provides a complete roadmap for the most effective clinical intervention possible for each individual patient.
Now, the brain and hypocrisy. We often see people fail to practice what they preach, and new research suggests this hypocrisy is actually rooted in a communication breakdown within the brain. A study published in Cell Reports found that when people act dishonestly while judging others for the same behavior, there is reduced activity in the ventromedial prefrontal cortex. This specific brain region acts as an information hub, helping us weigh rewards against social rules and moral standards. When this area isn't fully engaged, there is a disconnect between what we know is right and what we actually do. It turns out that matching our actions to our ethical standards requires a lot of active mental integration. It is not just a matter of having a bad character. It is a biological failure to integrate our personal desires with the moral rules we apply to everyone else in our social circles.
The researchers used functional MRI scanners to track blood flow in the brain, while participants faced conflicts between financial gain and honesty. They found that when we judge others, we don't face the same temptation of a reward, which makes it easy to hold them to a high standard. However, when we are the ones making the choice, the temptation can overwhelm the brain's ability to maintain consistency. This explains why hypocrisy is so prevalent in everything from minor office lies to major public scandals. Understanding that this is a neurologic process could change how we approach behavioral coaching and ethics training. Instead of just teaching rules, we might need to focus on strengthening the brain's ability to integrate those rules during high-pressure moments. It is a fascinating look at why the human brain struggles so much with maintaining a consistent moral compass.
Next, finding happiness during struggle. During difficult times, feeling happy can sometimes feel like a betrayal or something we simply don't deserve. However, teacher Wendy O'Leary suggests that finding moments of genuine joy is actually essential for building the resilience needed to get through those hardships. She shares a guided practice designed to help people notice beauty and connection even when they are suffering. This isn't about forcing a smile or pushing down the hard stuff. It's about making a little bit of space for the good to exist alongside the struggle. By tuning our attention to the sensations of the body and the reality of the present moment, we can begin to refill our emotional tanks. This fortifying effect doesn't just help us heal ourselves, it actually makes it possible for us to show up and support others who are also going through a hard time.
The practice is adapted from Rick Hanson's work on taking in the good. It starts with simple steps, like settling into a comfortable position and focusing on the felt experience of the body. By widening our awareness to include the breath and the physical sensations of sitting, we create a receptive state of mind. If difficult emotions arise, the practice encourages us not to fight them, but to let them be while still looking for small flickers of gratitude or tenderness. It is a gentle invitation to acknowledge that two things can be true at once. Life can be incredibly hard, and there can still be moments of genuine happiness. Strengthening this ability to notice the good is like a workout for your emotional health, ensuring that you have the internal resources to face whatever challenges come your way without becoming completely depleted.
Now, mindfulness and visual speed. A new study in the journal eNeuro shows that practicing mindfulness for just 1 month using a mobile app can significantly speed up how we process visual information. This benefit isn't just for young people, it applies to middle-aged and older adults as well. The research focused on a brain region called the locus ceruleus, which is responsible for maintaining focus and releasing noradrenaline. As we age, this area often degrades, leading to slower reaction times and increased distractibility. However, brief daily meditation seems to calm the overactive noradrenaline system that often comes with age-related decline. By grounding ourselves in the present, we are essentially training our brains to filter out irrelevant objects and react more quickly to what matters. It is a powerful example of how a simple digital tool can successfully alter basic cognitive functions and improve daily mental performance across all age groups.
The study, led by Andy Jisoo Kim at the University of Southern California, highlights how accessible these cognitive benefits have become. You don't need to spend years in a monastery to see results. A month of consistent app use is enough to make a measurable difference in visual attention. This is particularly important for older adults who may be experiencing the early signs of cognitive decline. By restoring some of the connection to the brain's attention networks, mindfulness acts as a sort of tune-up for the mind. It helps the brain compensate for structural changes by improving the efficiency of the remaining cells. In a world full of digital distractions, having a way to sharpen our focus and process information faster is an incredible advantage. It shows that our brains remain remarkably plastic and responsive to training, regardless of how old we are.
Finally, insurance and cancer survival. A sobering new analysis of nearly 470,000 Americans has found that for young cancer patients, the type of insurance they have is a major predictor of how long they will survive. Those with private health insurance lived significantly longer than those on Medicaid or those without any insurance at all. For some cancers, like melanoma, having private insurance meant a 2 to 2.5 times lower risk of death. This is especially critical for people between the ages of 15 and 39, a group that often faces unstable health coverage as they finish school, start new jobs, or age off their parents' plans. This instability isn't just a financial burden, it directly impacts when a cancer is diagnosed and what kind of treatment is available. It is a systemic issue that is creating a widening gap in survival rates for young adults compared to other age groups.
The research shows that insurance status shapes the entire cancer experience, from accessing specialists to starting treatment quickly. Strikingly, patients on Medicaid often had outcomes similar to those with no insurance, suggesting that simply having coverage isn't enough if it doesn't provide access to high-quality care. One of the biggest factors is access to clinical trials, which are often the only way to get the most advanced treatments. If your insurance doesn't cover these trials or the specialists who run them, your chances of survival drop significantly. This study highlights the urgent need to address the social and systemic factors that dictate who survives a cancer diagnosis. It is a call to action for better, more consistent coverage for young people during these vulnerable years, ensuring that their survival isn't determined by the type of insurance card they carry in their wallet.
That wraps up our briefing for today. Thank you for joining us to stay informed on these critical updates. We will be back tomorrow with more stories that matter to you.